SAFEMed works with the private sector to ensure delivery of HIV and TB medicines across the country. And why do we work with the private sector? Let me give a little bit of background that in Ukraine, it has the largest HIV epidemic in Europe. And also when it comes to TB, highest number of drug-resistant TB in the world. And at the same time, accessing the necessary treatments, there's a lot of bottlenecks in the supply chain system. And one of them is related to inconsistent availability of the commodities where they're needed across the country. And that's where the private sector comes in. And Ukraine, it actually has a vibrant private sector. The project, together with the government, decided to test out a model of using private sector logistics providers at the last mile to ensure that products could be available at a reduced cost, at a more consistent level, and more efficiently. And we tested that project out in one part of the country in Odessa in 2020, and since then have been scaling that program. And in fact, in 2021, we were the global winner of a prestigious private sector innovation prize through the Council for Supply Chain Management Professionals. Ukraine has suffered many years of legacy of Soviet-style health systems, and that has been an important factor in the SAFEMed project, looking at ways to modernize and ensure that market-based solutions could be brought to bear. And one of the early successes the project had was helping the country establish what's known as the Central Procurement Agency. And it was designed in response to the problem of too much wastage in the procurement systems, individuals having to pay too much out of pocket for their medicines, and the need for the country to identify a specific set of medicines that are needed most essentially for the population. Since then, they saved the country more than $33 million, which is about a fifth of the budget for the purchasing of medicines. So it's been quite remarkable. I would say there are really three main areas that have allowed the country to take this lead and the role that MSH has played in that. And the first is around political leadership at every level. Immediately upon the war, the cabinet of ministers had put in place a set of rules around how humanitarian aid would come into the country and who would lead the different aspects of that, and coordinated donations from more than 40 different governments and organizations and countless individuals. The second is around enabling information systems that allowed not only the aid to come in, but to have a very fine-tuned system to ensure that the aid was going where it was needed most and as fast as possible. And the third ingredient for success was really tapping the private sector. With the help of our project, identify what organizations were available in the time of the war. And we contracted warehouses in strategic locations across the country, and then a set of logistics providers that were able to deliver. And that was only possible by engaging whole of country, and that includes the private sector. It's a constantly evolving situation. So what do we do as a project and as an organization to ensure that we can meet that balance effectively? And really, I think for us, it's about enabling the government to be able to lead and set the agenda, and not getting out ahead of them, and setting up platforms for the government to be able to be in line with the broader civil society around those reforms. For example, around price capping, so that the rapid increase of medicine prices due to the war and the destabilization can still protect individual consumers. So now I'd like to talk about what are really the challenges, but really then turning into opportunities. And really those opportunities are threefold. The existence of a vibrant pharmaceutical sector is really a critical success factor that will enable any reforms that the project undertakes to really take hold. And that includes an expansive local manufacturing sector. Second is really a vibrant private sector of civil society, patient organizations who represent and effectively advocate at the highest level up into the office of the president for quality medicines, for availability of new medicines, and for the reforms that are needed to ensure that budgets are available to purchase medicines. And lastly, I would say one of the other areas is around continuing to encourage the government in its journey to reform and ensuring that all of the data about what is going on in terms of the Ministry of Health is openly available on its websites, on open platforms for tendering. So anyone who wants to track and follow what's happening with the reforms can do so because of this commitment to openness. And I think really encouraging that openness and continuing to support that is going to be most helpful.